Welcome back. People are back at school. We're still dealing with COVID. Flu season's just around the corner, and we're starting to see a lot of coughs and colds. Well, if you're in school, we also happen to see head lice. And if it happens to you, here's how you can take care of it. Pediculosis, commonly known as lice. Head lice, body lice, pubic lice, cooties, or crabs. Pediculosis is an infestation in the hairy parts of the body or clothing, with eggs, larvae, or adults of lice. The crawling stages of the insect feed on human blood, which can result in severe itching. Head lice are very small and sometimes difficult to see. Who gets pediculosis? Anyone may be infected under suitable conditions of exposure. It is easily transmitted from person to person during direct contact. Head lice infestations are frequently found in school settings or institutions. Usually, the first indication of an infestation is itching or scratching in the area of the body where the lice feed. Scratching at the back of the head or around the ears should lead to an examination of the head for louse eggs or nits on the hair. Use a bright light to check the crown of the head, the bangs, and behind both ears. Place gloves on your hands and use your fingers to separate the hair and create a part where you can clearly see the person's scalp. Look for lice crawling on the scalp where the hair is parted. Look for nits near the hair follicle close to the scalp. Nits will be white or yellowish brown. Also look behind both ears and near the back of the neck. You may see lice or nits, or you may see bites. There are several home remedies you could try. Wet combing includes simply wetting the hair and using a fine-tooth comb to remove the active lice and their eggs. You need to do this every week for at least 3 weeks. Plant oils, such as tea tree, may suffocate and kill lice, but it's not clear how this may work. And you also have the risk of an allergic reaction to these topical essential oils. Some people try to suffocate and kill the lice by putting large amounts of a greasy substance on your scalp, such as petroleum jelly, mayonnaise, or olive oil, but these may not always work well. There are also over-the-counter medications which can be purchased that are sometimes effective. Once you have treated the lice, you also need to remove them from your home. Wash any items used or worn by the person in hot water and dry them on high heat. Lice and nits die when exposed to temperatures greater than 130 degrees for more than 5 minutes. If you can't wash the items, toss them into a plastic bag and seal it for 2 weeks. Vacuum rugs, sofas, upholstery, other furniture, and floors to remove hairs that may have active lice eggs attached to them. Clean your brushes and combs and other accessories in hot, soapy water. Be careful about insecticide fogs or sprays, as they can be toxic if inhaled or absorbed through your skin. If home treatment of lice has not been effective, if you have open sores or crusting on the scalp, a fever, or enlarged lymph nodes, it may be time to see the doctor. There are prescription treatments available that are effective. Catching lice does not mean you are dirty or unhealthy. It's just a little bug that likes everyone, and if you're infected, get treated.